I love when people come in and I say, what's your experience with animals? Oh, I have a dog at home. Okay, and that's fine, but, like, that's where we're starting here.
Tell me what it is that you want the world to know about what it is that you guys do. Like, why? Because I think what happens is there's a lot of complaining. There's a lot of blaming that happens, like, in the ether of, I work in a vet clinic and I'm underappreciated, we're understaffed, I'm underpaid. There's a lot of negativity on that front, but what I think that is just a symptom of not having a shared reality of what is actually happening so that we can get to a solution. Like, I will agree that there are limitations and problems that exist. However, what is the actual reality of what it is that you guys do?
So I can do the CBT realm of it. I can let Autumn do the MSS realm of it. I know there is some things that do cross paths between CBTs and MSS. I do know there are a lot of shortcomings that happen between perspective and reality of caregivers when they come in, which is why we have such a high turnover rate, or unfortunately the high suicide rate that our field has. But as far as it goes for CBTs, in a day, we're placing IV catheters, we're drawing blood, we're getting patients hooked up to fluids, we're getting medications drawn up. They're going into surgeries. We're the ones that are in there monitoring the patients when they're under anesthesia, catching when those vitals start trending downwards and they need rescue drugs coming in. We're recovering them. I don't know the day practice aspect of what CBTs do in that. I know what we do here. And the doctors do the surgeries. For the most part, I'm in there monitoring anesthesia, and if I start noticing something going bad, it's like, hey, I'm adjusting my fluids, or I'm giving this medication to this patient, or we're turning down ISO, and then when they're off the table, it's like I'm in back recovering them, and the doctor is making that post-op phone call.
Yeah. So you're kind of the hands that cover the front and the back of that of the surgical process, but also of the fulfillment process. It's like you're kind of just you're the here's a comparison or a metaphor, because I always think metaphorically. You're the rifle that actually fires the ammunition. They might a doctor will give you the ammunition, but and one can't work without the other. But in an ideal scenario, a doctor doesn't actually have to shoot. They just tell you how to shoot.
Yes.
Right?
Yes. And it's kind of the same for the medical support side of it as well. And Autumn knows that extremely well, because I think you do everything I can do except for run anesthesia and write euthanasia and
give rabies vaccines.
Yes, and the good old rabies vaccines.
Yeah.
Well, when it comes to medical support staff, there is such a wide range of skill sets here. So some of our newer or less experienced medical support staff, they start with just like your animal handling. They will bring the patients up front when they're ready for discharge. We have a few that are here and they do not communicate with caregivers. It's what they're here for. They're here for patient handling. They're here to help us in the treatment area. And then it works all the way up to, there's a few of us that are about ready to become technicians. And it's
you being one of those.
Yes, I'm just about there. But there's a few of us, and then when you get to that skill set, it's like we can do quite a few things that you wouldn't think that we probably could. So we can do all of the vaccines minus rabies. We can still draw blood. We can run blood work, set up for like urinalysis. We can look at cytologies and things. Mostly they'll get checked over by somebody, but we can at least give it a go and practice. Like yesterday, I was practicing blood smears for 15 minutes because I need to work on those.
Dude, that's I've been in this for 6 years, and that is a skill I can't even.
Trevor was teaching me.
I can't master that.
Perfect. It's not fair.
6 years, still can't do it.
Yeah.
Heather, is this good? Yeah, I can see what I need to see. Perfect.
Yeah. So, and then there's a lot of I feel like the medical support group does a lot of the estimate presentation, hospitalized paperwork, all of that stuff, because that's usually delegated to you by the technician who's running triage.
Yes.
And that's mostly always a technician. So it's, hey, can you do this? And if you have questions, you just go back to your technician and touch base, see if you need help with anything. And no one's ever going to say no to help with something. So there isn't ever any issue in that. It's just there are so many different learning stages. Like if you took our medical support staff group, we're all at a different place. We're all very individual.
Yeah.
In where we are.
And that's an important piece of context for those that don't know who you are or what you do. You are our medical support staff coordinator, so you train everybody in that role. So you're taking basically, like, I've never touched anyone else's animals besides my own, all the way up to, you know, that like pre-technician phase.
Yeah, that's actually a transition I love. I love when people come in and I say, what's your experience with animals? Oh, I have a dog at home. Okay, and that's fine, but like that's where we're starting here. So it's like, get this patient out of the kennel and bring it up for an exam. Like that's your first thing. Put it on a leash, bring it up to the doctor.
How to get it safely out of a kennel
yes,
as well.
Exactly. Cats, how to get a cat safely out of a kennel.
I've been lucky this weekend, and I have had all nice cats.
Oh
Not
my gosh.
one has tried to kill me yet. Well, okay, one tried to kill us, but sedation.
Yesterday we had a cat that was fired from their RDVM, and they are not welcome back there because their cat is so naughty.
Thanks for checking out this clip from the PAWCast Veterinary Podcast. If you are interested in watching this full episode, you can go ahead and find that right here. And if you're ready to be the force of change in veterinary medicine, go ahead and click subscribe right here to learn more. Thanks.